offer functional rehab services for people who their goal is to go home, but they've had an injury or an illness and they've been in the hospital, so they come to us after that in order to increase their function so that they can go home at a level as they were prior to getting ill. So once they are evaluated, then they get put on a specialized care plan that meets their individual needs, and then they are treated daily. Everyone gets PT, everybody gets OT, and then speech therapy if that's needed. So it's set up so there's the physical therapist will go in and do their evaluation. The occupational therapist will go in and do their evaluation. Speech therapist will do theirs. We come together and discuss each patient. We're all together, so we're constantly in communication with each other. Sometimes we co-treat, so sometimes PT and OT will treat together if that's needed. So it's all about the patient's goals and what's needed. The objective is to increase the patient's mobility, to get them to their prior level of function. If they were walking prior, we're going to work on all the skills needed to get them to be able to walk again at their prior level. If they weren't walking, but they were at a wheelchair level and they were functioning in their home, then we're going to work on balance. We're going to work on trunk strength, we're going to work on mobility, we're going to work on range of motion. So we're going to work on all those skills needed to get the patient to function at their prior level. So we have a lot of specialized equipment. We have a light gate system, which is a balance system that holds the patient up and takes kind of the gravity out so that it enables them to balance better. If they have a lot of balance problems, it enables them to walk with less strength. They don't have to have as much strength to be able to walk and move. We have modalities, so we have ultrasound, we have E-stim, we have diathermy, and we have a Biodex balance system, which is a unique piece of equipment that you can stand on, and it does biofeedback on your balance. So the patient plays a game kind of, and they can kind of see their balance and they can see their sway and they can see if they're getting out of their center of gravity or not. So it gives them the biofeedback component, which is helpful as opposed to just having someone stand there. So an occupational therapist is someone who's going to help you try to get back, work on your activities of daily living. So that by that you're talking about bathing, dressing, going to the bathroom, higher level activities of daily living such as cooking, cleaning, medication management, money management, all the things that we need to help to be independent at home. They're going to work on balance because you need that to standing up and doing activities. They're going to work on range of motion. Occupational therapy usually works on the upper body more than the lower body. PT usually works on the lower body more than the upper body. We have equipment, Bioness L200, which is kind of an electrical stim, but it also gives biofeedback at the same time, so it can help increase your range of motion of your upper extremity. We have one for the lower extremity too. They'll evaluate your swallow. So they do that in a number of different ways. They can do a modified barium swallow, so they'll go over to the hospital for that. So they also have the ability to do the FEES study. They also will just evaluate and observe how you're swallowing. They'll feel for your swallow. They'll feel for the delay in the swallow. So once they kind of figure out where you're at and what diet you're on, then they're going to work to upgrade your diet. So someone might be come in and they have a very weak swallow muscles, or their swallowing is not very coordinated, and so you're a risk for aspiration. We also have vital stim, which is kind of like E-stim for your electrical stim for your swallow muscles. All working to get you stronger there and to get the coordination better so that you can upgrade your diet safely without being an aspiration risk.